Welcome to the Libido Lounge, where we focus on all things love, lust, and libido. We believe that fabulous sex is important to health as exercise and good food. Hey, everybody. Welcome back to another episode of The Lounge. I'm your libido expert, Dr. Diane Mueller. And today I have such a pleasure. I have such a treat for you guys. This is the girlfriend doctor, Dr. Anna Cabeca, and I am very excited about this conversation. Dr. Anna and I spent some time on New Year's Eve together, just chatting away about fun stuff as far as what we do in the field for supporting women. We're going to talk today about something that we haven't actually talked a lot about on this show. We've been dancing around it so far, talking about all these other root causes of low libido. And now we're getting into the juicy topic of the essential thing that we have to have in order to have a healthy libido, which is hormones, healthy hormone level, healthy hormone balance. So welcome to the Libido Lounge, Dr. Anna. It's so good to have you.
Oh my gosh, it's wonderful to be here with you. Thanks for having me, Diane.
It's such a pleasure. So let's go into just hormones in general, since we haven't talked a lot about this. When we're talking about hormones, what hormones are we talking about? And can you just kind of walk us through, just set the foundation of today's episode around what hormones are we talking about and what do they impact, right? I think so many people think about hormones and they think about their menstrual cycle or they think about menopause, but there's obviously so many things that we know beyond that. So will you just kind of set the stage for us in that regard?
Oh, yeah. I like to think of hormones as there's hundreds and hundreds of hormones within our body that we've identified to date, right? And within that, if you think of the hormonal, all the different hormones that our body has are reproductive hormones, which change with our cycle and change with our lifetime and how those are changing. We know that in the early perimenopause, mid-30s on, our progesterone level starts to decline pretty sharply. And then with that, estrogen levels also decline and fluctuate, just amazing fluctuations of estrogen. It's crazy. It is a crazy hormone. And those are two key of our reproductive hormones, as well as DHEA, which for both men and women, DHEA affects your libido very, very much. And it starts to decline in our mid to late 20s. So we start to see this drift off of DHEA, which is a precursor, which makes further down the line testosterone and estrogen. And testosterone is another hormone significantly we think of with the libido, and that gradually declines as we age. Significantly so, again, the same time period, 35 to 55, but more so, just gradually from there on out. So by the time we're in our 60s, we have 65 to 75% less testosterone than we did in our 20s.
Yeah, thank you for that. And I also think it'd be helpful for people to understand too around all of these different hormones. It's like, okay, we have these changes with cycles, that sort of thing. So we're expecting these changes to happen as we age. But one of the things that I think we forget about oftentimes is the impact on these hormones around brain and cognition. And sometimes we talk about pregnancy brain or menopause brain. We have these terms we throw around, but that brain impact too, I think, is one of the biggest things that we see as far as the functionality of life. So how do these hormones actually make a difference beyond, say, our normal cycles?
Yeah. So that's a big thing, this whole, hormones and the mind and the brain. And I trained at Emory University in Atlanta, Georgia as a gynecologist and obstetrician. I had studied the hormonal pathways. I knew the rate limiting steps and the enzymes that were involved, right? But when it comes down to it, we really don't understand how that's affecting the rest of our physiology. We know as women, if we're having PMS symptoms, it doesn't just come with maybe a more heavier, crampier cycle. It comes with weight gain. It comes with mood swings, irritability, brain fog sometimes. And those are significant neurologic issues. And as we age, perimenopause and menopause and beyond into our second spring, we have a significant shift in our brain's ability to use glucose for fuel, because as estrogen and progesterone decline, our brain's ability to use glucose for fuel and make it also declines, as well as other muscles within our body. It is, glucose is a key factor. And what's happening here, because of that dependency on our hormones, on estrogen and we know, and probably progesterone, we see the irritability, the brain fog, the mood swings, the memory loss, the insomnia, and like those aren't GYN symptoms. So our hormones go beyond gynecology or male's health and male sexual health. And so during this time, what I discovered as my own personal, menopausal journey is not once, but twice now, finally in my second spring of my life at 58 this year. So excited about that. And what I've seen, what I've witnessed is that when we shift from using glucose as a primary fuel source to using ketones and bumping into ketosis on a regular basis, then what we see is that brain fog lifts. The memory is sharper. Your ambition, motivation, willpower is all stronger. Your moods elevate. And those other endocrinological, so those are neurologic symptoms. The other endocrinologic symptoms that, shift, like the hot flashes, for instance, and the weight gain without doing anything different, those all resolve too. So that's a huge part of this hormonal shift. And how it affects our libido is that, it's affecting our reproductive organs. It's reflecting our vaginal health. And that's a really big thing. It also affects our emotional health. So getting a control, and the good news is, after all that, like grim news, y'all, that the good news is that, we can do something about it. No matter what you're dealing with, there's not one patient, thank God, to date, that I haven't been able to help in some way or another. So it's really empowering to know that. And I want people to feel empowered with this information.
Yeah, I think it is empowering, especially when you talk about the changes in hormones in the 30s, right? And so many times we are not thinking about that in the 30s. Like we wait until we start to experience the hot flashes or the weight gain to all of a sudden, say like something's wrong, which of course is still fixable. And there's things we can do and we can support and help and all of that. But it's so empowering to think about, well, we can actually start looking at this in the 30s. So as far as sexual health, hormone health, healthy libido, all these topics, is the 30s where you would say from a preventive standpoint, is that when you would recommend for most women, they really start to check in on their hormones, get lab tests done, make sure that things are kind of in working order?
Yeah, I think it's a good idea to look at your hormones during that time and see what's your natural balance? How is your estrogen detoxification pathways? That's the one that really seems to be most associated with getting us into trouble. But beyond our hormones too, looking at our full thyroid panel, looking for thyroid antibodies, checking vitamin D, which is more of a hormone than a vitamin. And because that's necessary at every one of our hormone receptors to function properly, it helps us tweak. But I say it's never too early, it's never too late.
Yeah, I love that so much. It's so, like you said, it's so empowering. There's things we can do at any age. And I want to talk a little bit more about DHEA, and I want to talk a little bit about safety and those sorts of things. And your Julva product that I have here, that I have to tell you a secret. I have all my travel bags. I have so many different travel bags for the different types of trips I go on because I'm always traveling. And there's certain things that are literally in every single travel bag. So I never am without them. And Julva is one of those things for me because I have seen so many amazing results. I feel like I'm 44 this year. And so I'm kind of in the middle of kind of the stages of all of this. And it's been the most supportive thing for, I feel like, vaginal health. I've experienced vaginal pain that it helped me with, was experiencing numbness. It helped with that. My libido is really strong. I feel like I was even starting some of the vaginal dryness stuff, and this has helped with that. So it's been just so broad and wide as far as what I've seen with it. And I know people get scared sometimes about using some of these hormones. And so from a fear factor, as well as an application, I use this as I know it's intended on my vulva. And I know that also scares some women. So can you talk a little bit more about the supportive nature of DHEA, what it does, as well as alleviate some of the fears around use of this?
Yes, definitely. And also, like Julva, I always say clitoris to anus, the most important real estate of our body. Keep that healthy. We forget, the clitoris will shrink as we age. The tissue around the urethra, so will thin out. And so we have more leaking issues, more urinary tract infections issues. We can reverse that. And then around the anus, the anal fissures, tenderness and pain and discomfort. And that's a really nice erogenous zone. So like you think about these things and you want to keep it as healthy as possible. And as a physician in practice, I started really working into compounding hormones and sexual health in 1999 with a patient that came in. She was 63. She'd had been diagnosed with ductal carcinoma in situ and of the breast, of the left breast. And she was, 5'10", 150 pounds, and just this silver-haired, incredibly intelligent woman who came to me. She said, Dr. Anna, my vagina is so dry, it hurts to have sex. I have no sex drive. I'm a woman of the 60s. I love my husband, and I'd rather die than live this way. Help me. And I was like, okay, because my Emory, physicians won't give me estrogen. They say it's contraindicated. And so I said, well, let's look at the research. At the time, we knew that vaginal estrogen is safe. And especially in her case and with her lifestyle and, really paying attention to healthy lifestyle. And so the other piece was DHEA and testosterone. Very safe, can even be beneficial. And so we can't hold that back. So I started working with compounding, my local compounded pharmacy, and I created a combination of creams, for many different reasons over the years. And when I retired my practice in 2015, I'm back in practice, but when I retired, burnout, let's say, from my practice, my patients were like, Dr. Anna, no one will give us your creams, lotions, and potions. And, really missing it. Many physicians just aren't trained. This is back in, 2000 or, mid to, 2013 to 15. And so physicians aren't trained in customizing, creating a recipe for their patients. Now, I love recipes. I've written 3 books, lots of recipes, my family of gourmands and chefs and bakers. And so I'm like, okay, I'm going to come up with the perfect concoction that you don't need a prescription for. And so DHEA, because it's over the counter in the US and it has such an extensive safety profile, it's been studied for over now, extensive research over, over decades, but definitely over the last 15 years in vaginal health in McGill University in Canada. And DHEA use in breast cancer patients vaginally. And for, that's like our highest risk when it comes to hormonal cancers as well as endometrial cancer. And so showed benefit and no increased risk of breast cancer. In fact, increased quality of life and decreased mortality, less likelihood to die from breast cancer. So, it was like, it's a no-brainer for me. But I knew from being in the cosmetic industries too, as time has, ventured with me as a chemist too, working with natural skincare products and the importance of that, especially through my own journey of infertility at 39, diagnosed with early menopause. Just hell and back. And I had to find things that were natural, clean, and enabled my body to function healthier on its own as much as possible. So I got into, really understanding the ingredients in skincares, plus with working with my compounders. And I added in plant stem cells from the alpine rose to my product, Julva, that I created to be, without a prescription that any woman can get in her own advocacy for her pelvic floor health. And over the years, and more research shows DHEA to support our immune system. So we give it in our long haul COVID patients. We, will optimize your DHEA. And because of the stress and the toxins that we've been exposed to, it really has affected our glandular natural hormonal secretion. So I always want to support the glands. And I do that nutritionally and with some herbs. And then also, adding back topically natural ingredients that are safe, not just for you, but if you have a male partner, safe for them. Estrogen, not so good for your male partner. And so, and that's something people really don't talk about.
Yeah, thank you so much. And thank you for bringing up the research on cancer and some of those things. I think more and more we're finding people are more educated on some of that poorly published research as far as those statistics, but it's just great to continue to remind people around safety profiles and that sort of thing. And I love knowing clitoris to anus. I'm going to completely change how I use this product. So that's really helpful. I also think it'd be worth talking about, because I know more and more people that are seeking out holistic, functional, alternative types of doctors and clinicians are measuring their DHEA. And reference ranges for this are so bad. So people will sometimes come in, like women will sometimes come in with like a 65 DHEA sulfate, and tell me like, oh yeah, DHEA is fine. So I know we both probably are very similar in, feeling like, hey, we really want to bolster this up. So where do you recommend, if people are getting lab testing, like how do they determine what is actually a good DHEA number?
Yeah. And it depends on how the lab's tested. So sometimes people mistakenly draw a DHEA blood test. And DHEA sulfate, as you mentioned, that's the test we want to look at in the blood. And we want that number for women to be over 150 to 300. But 150, that's optimal for me, around 150. It's hard, especially postmenopausally, to get up that high. But again, we want to empower our body to do that on its own. And that's really where we want to be, at least over 100. But so many people, like you said, I see them in the teens, the 30s, 40s. And they're just like, boy, that is a good place to start with a patient. And in the saliva, if you're not on any steroids, and salivary testing is tricky, but you can look at your DHEA and cortisol pattern throughout the day, as well as with urine. Urinary, you're looking at DHEA metabolites, and you're looking at your cortisol pattern. You should be looking at your cortisol pattern throughout the day. So those are, those are important ways to test and look for optimal levels there. And you kind of want to look at the mid-range, but not on blood work. When we look at blood work, and I know you go over this, Diane, but we are comparing the normal American population. So I encourage you to sit outside Walmart for, an hour and just track the number of healthy people you see that you want to be like how they're radiant, they're smiling, they're, and they're fit and healthy looking at a happy, healthy weight. And, and that's your normal comparisons.
Yeah.
And so, yeah.
Yeah. I
like Walmart, by the way, y'all.
I like that image. It's very easy to, I think, put oneself in that ability to say like, oh, this is what we're comparing ourselves to. Like, this is what we're saying, like healthy is. Like, we really have so much to do as far as, I think, raising the standard of like, what is actually, I like to differentiate between what is common and what is normal and healthy. And just because it's common does not actually mean it's like a normal, healthy, lab value.
Right.
So I want to talk in our last few minutes together about something we have talked about a lot on this show, but I think it's important in context to tie this whole hormone picture together, which is oxytocin. So our love hormone, our cuddle hormone, our touch hormone, our orgasm hormone. Where does oxytocin fit in as far as hormone balance into this whole picture?
Yeah, oxytocin is the most powerful hormone of our body. It is, in my hormonal hierarchy, it is the head honcho, right? It is the crowning hormone. And under that is cortisol, insulin, and adrenaline. And then further, you have all our reproductive hormones. So oxytocin is really powerful. It's also not well known, but this fact is that it's the most alkalinizing hormone to our body too. Oxytocin's been associated with, happy, healthy marriages, happy, healthy, long quality life. The characteristics of creating oxytocin are common in the blue zones, the areas of the world that have the largest number of people over 100. And also it supports our immune system. And what people don't realize that as progesterone and estrogen decrease, that affects our production of melatonin, which also produces oxytocin. And so if you're having sleep disruption, you're likely not making enough oxytocin. You may feel more disconnected, more alone, less social interactions, and it's powerful to be able to create habits and do things that increase oxytocin, and having sex, intimacy, enjoying your partner, positive touch, and especially orgasm and climax, they increase your oxytocin tremendously.
Yeah, thank you. It's one of my favorite things to talk about, because I feel like we have this amazing chemical in our body that really, like you said, is the master thing. We get to modulate, we get to actually impact so many areas of our life. So this amazing chemical like regulator that so often it's so easy to be like, I'm too busy for pleasure. I'm too busy for touch. I'm too busy for sex. And so I think it's just an important thing to come back to of like, this is like the hormone that is capable of doing so much to bring us back into balance and joy and relationship and connection, all these amazing
Absolutely.
things. So I want to make
Absolutely.
sure we talk about Summer of Love, and you guys, that we're going to have links as far as how to get Dr. Anna's Julva in our show notes here. So that'll be for you. Also want to make sure that everybody knows that we'll have links on how to get a hold of you and work with you in our show notes. But what else do you want to leave us with? And I know we wanted to mention the Summer of Love as well.
Yes, definitely. And I want to mention too, like one of the reasons that couples, disconnect or there's a loss of desire, loss of connection is because of vaginal dryness issues, the discomfort with sex, pain with sex, and, improving the health of the vagina. And it goes beyond sex, right? Decreasing urinary tract infections, incontinence, keeping a healthy pelvic floor is critically important till we age. And so I really want to emphasize that. Sometimes we don't even know why we became roommates, but if it's not pleasurable, you're not going to want to do it. And it's so important because that is a way that we get a huge burst of the, age-defying oxytocin. So I want to mention that. And especially as a gynecologist. And regarding Julva, we are offering your audience, Diane, the free link to the free trial of Julva. So it's a 7-night trial, but you're going to want the full tube. And our Summer of Love sale is our biggest sale of the year for Julva. So encourage you to definitely take advantage of it. And let me know any questions you have. I have the most amazing customer service team. We're here to help.
Thank you so much. And I hope everybody will take advantage of that and become a total Julva fan in the way I am, fangirl of putting it in every piece of luggage I have. Don't want to leave home without it. So thank you so much for being here with us today. And I really appreciate you and your time and your wisdom and offering these gifts to our community.
Oh my gosh, I love it. Thanks for having me.
All right, everybody. Well, this is a wrap. You've been with us for another episode on The Lounge. Dr. Diane signing off here, always reminding you to stay classy, stay sexy, and always be a little badassy. We'll see you next time. Thank you for listening to the Libido Lounge. Please don't keep me a secret. Please share this with your friends. You can find me on YouTube, on Instagram, as well as how to work with me at mylibido.com.